Welcome back on this Friday. You know, health officials say most people are infected with West Nile virus this time of year. We hate to hear it. And today, joining me is Mike Mannell from the State Department of Health. He's with the Infectious Disease Prevention Program and Response Service. You know, it's sad that we have to do this every year, talk about, West Nile, but it is dangerous and you don't want to get the disease, do you?
Absolutely not.
What can it do to you if you get West Nile?
So West Nile can have a lot of different ways that it presents itself. Thankfully, up to 90% of all cases of West Nile virus are asymptomatic, so those individuals may not even know that they're currently infected with West Nile. For those that do experience symptoms, the large majority of those are also fairly mild. We would expect flu-like symptoms, so chills, fever, headache, maybe some muscle aches. But unfortunately, in a few very rare instances, you can have what's known as neuroinvasive presentation, and that's typically what you see for patients that are more hospitalized and unfortunately sometimes associated with deaths.
Yeah, and it could be, long-term effects it can be from West Nile. What are the numbers in West Nile? Like how bad is it? How prevalent is it here in Oklahoma?
Yeah, so typically we expect to see some seasonality with West Nile, so we are going to see human cases every single season. Typically, your standard West Nile season, year to year, runs from about the months of May all the way through October. We have seen a relatively late start to the season this year, so we just have started to see human cases picking up in July. We've also started to see some of the mosquito pools that we test throughout the state testing
Are
positive.
you then fearful that it might go a little longer since it started a little later? Do you know? I mean, is that what you're thinking?
It can be hard to say. There's a lot that goes into account with West Nile. There's a lot of environmental factors to be taken into consideration, things like temperature and precipitation. But we do expect to see cases continuing to increase throughout the summer months.
Well, we always know the mosquitoes kind of start getting around the water. We've had some rain today, and then you get that heat. I mean, it's kind of like a bad combination, isn't it?
Absolutely, yes. So we really like to focus mostly on prevention when we're talking about West Nile virus. And with West Nile, we like to refer to what's known as the 4 Ds.
What are those?
The 4 Ds are dawn and dusk, which is the time of the day when mosquitoes are most likely to be present and active. So those are when you should be taking the most precautions to protect yourself. You've got dress. If possible, you want to wear long sleeve, light colored clothing, even pants if you're able to. For any parts of your body that you're not able to cover up while we're outside working in the yard, because I do understand it's a hot time of year to be wearing long clothes. You'll also want to wear DEET, which is our 3rd D, which is DEET is the active ingredient in most mosquito insecticide repellents, but there are some alternatives also available. And then lastly, the big thing that you can do around your house and around your community is drain. That is to identify areas of opportunity where mosquitoes might lay eggs in standing water. This can seem really innocuous. You may not even think about it, but things like bird baths, pet bowls, toys out in the yard, pool covers, those create great opportunities for mosquitoes to lay eggs and therefore increase their numbers.
Is it true you could put that skin so soft and it keeps mosquitoes away? Have you ever heard that? Probably an old wives' tale.
I haven't heard that, but it is true that mosquitoes are attracted to different types of blood types more so than others.
Okay, that's good to know. I always feel like I'm outside and boom, about every 2 seconds it feels like they're coming after me.
They like me too.
Oh,
I tell my wife it's because I'm so sweet.
Well, there you go. Well, Mike, we like you too. Thanks so much for being here today. We really appreciate great information there.
Thank you
so much.
so
I like the 4 Ds. Okay, that sounds good.